We thank you for joining us for the Levesque Institute for Civic Engagement's Presidential Election Series to inform you, the voters, on the issues that are critical to this year's presidential election. The intent of this series is to keep political views out of these sessions and bring facts that we hope will help you become informed through the lens of what candidates you feel will be the best to carry out our democratic principles. In these divisive and turbulent times before us, this year's presidential election will determine the future direction of our country and the future for decades and years to come. I would like to introduce and thank our two other facilitators for this evening from the Levesque Institute team, Brittany DePietro, the Levesque Institute Program Manager.
Hi everyone, thank you so much for joining us tonight.
And Kara Oliver, Director of Strategic Initiatives.
Hello, everyone. Thank you again for being here.
Thank you, Brittany, and thank you, Kara. The format for this evening is 5 minutes of facts on each of tonight's topics. There will be a 10-minute discussion or questions for each of the topics, and we'll then move on to the next. There'll be a total of 4 topics for the evening, and we hope that what you're coming in with, you will leave with much more knowledge and feeling much more informed. To start us off tonight, we're going to start with the COVID-19 pandemic. To date, the COVID-19, as of yesterday, these facts are from the Johns Hopkins University Coronavirus Center. The global number of cases, as you could see on the screen, is over 38 million. The United States is almost at 8 million, 21% of the global cases. The global death rate is almost at 1.1 million. The United States death rate is almost at 220,000, 20% of the global deaths. Unfortunately, the US has the highest death rate out of 188 countries. You can see this on the screen outside of Brazil, and Brazil's death rate is going down, where the United States is still peaking back up again. Let's take a look at the timeline. How did this all start? When we first found out in December of 2019 was the first COVID case in China. In January of 2020, the virus came into the United States from both China and Europe. In January 2020, the World Health Organization declared a global pandemic. In March 16, 2020, the United States declared a national pandemic. President Trump announced that there are no national closures. It would be up to the governors in each state who would determine pause orders. If you look at the timeline on the right, you'll see when each state in the country closed. There's 46 that closed, 4 to date have not had any type of pause within their states. You can go on and notice that as of April the 7th, we had 395,000 cases. And look at where we are now in October of 2020. From March to October, our cases have continued to rise. And as of October 8th, we had the highest number of COVID cases since July. As of today, 36 states have spiking COVID-19 numbers. How has this affected our economy? The unemployment prior to COVID was 4.9% nationally. During COVID, it peaked at 15.4%. In April of 2019, our unemployment costs was $3 billion. In April of 2020, it was $49 billion due to the $600 a week addition under the CARES Act. In terms of stimulus package costs, $25 trillion in debt our country is, where COVID-19 has added $2 trillion to that debt. Our stimulus checks cost $290 billion. So the total added cost of the national debt has been $3.1 trillion, with another stimulus package hopefully to come. In terms of eviction and foreclosure, there's 16 million households unable to pay their rent as of July 2020. The potential is for 11 million evictions filings in the next 4 months. If we look at the economy versus our health, which is really important. There's been a lot of discussion and a lot of debate. Do we treat the health first and then the economy, or do we look at the economy and health together? Countries which suffered the most severe economic downturns, like Peru, Spain, and the UK, are generally among the countries with the highest COVID-19 death rate. If you look at countries that have the most modest, like Taiwan and South Korea, they've managed to keep their death rate low. If you compare the US and Sweden with Denmark and Poland, who saw economic declines around 8 to 9%, but death rates are markedly different. The US and Sweden have recorded 5 to 10 times more deaths per million. The conclusion to this is the relationship between the health and the economic impacts of the pandemic goes in the opposite direction. As well as saving lives, the countries that control the outbreak effectively may have adapted the best economic strategy as well. And you see the United States up here. We are at the high, right there. So when we look at the positions of the two candidates, the major candidates, needing a national plan, the president has thought we have not. The Vice President, Joe Biden, the challenger, yes. I'm not going to read all of these. You can see them in front of you. But obviously, the two candidates have varying positions in terms of the 6 things that we're measuring here tonight in terms of the issue. And I think the biggest is, would the shutdown economy, again, if scientists recommended it? The current president, no, and the challenger, yes. So when we look at some points to consider that hopefully will spur our discussion tonight, should the U.S. government have shut down prior to March 16, 2020? Would a national plan have put us in a different place than where we are today? Was the lack of personal protective equipment the cause for having the highest number of deaths out of 188 countries? Should public health be put before the reopening of the economy? Has the COVID-19 pandemic become so political that it is slowing down the nation's health, economy, and employment from returning to solvency? And then we find out today that the Canadian government continues to keep the borders closed based on the US getting control of COVID-19. I'm going to now open it up for discussion, questions, and please feel free to ask any questions or at the same time spur discussion among all of our participants. Do we have any questions? Any discussion? Would someone like to open it up?
I'll open it up. I think one issue that wasn't there is the issue of how different population groups in this country are impacted by COVID. And there have always been issues of lack of inclusion and inequity of different services, including healthcare. I think this COVID virus has only emphasized just how serious a problem it is. And COVID didn't create the problem, but COVID is a stark example of when a pandemic hits, how inequities and different classifications of people affect outcomes.
Thank you, Warren. And I think you'll see we have that addressed in 2 other topics this evening.
Okay.
But I'm glad you brought that up because it certainly has been even more affected with the COVID-19. But we certainly will be addressing that in 2 other topics tonight. Anyone else, questions or discussion? I'd like to spur some discussion with some of the things that we talked about with the points to consider. Do we really, all of you on the line, do you feel that if we would have really reenacted the Defense Act sooner, that we might be in a different place in time, both with economic factors, where some more businesses maybe wouldn't have closed, but they would have opened in a different direction and supplied us with some of the PPE we needed? Do you feel that that had any impact on where we are as an economy today and with our death rates?
Hi, Patty. This is Emily. I'm not too familiar with the Defense Act, but I feel as if the issue with our death rates is more so that we didn't have a federal mandate no mask mandate, the nation didn't shut down. So even with this protective equipment, it doesn't really help if the hospitals are being overwhelmed in the first place. And I really think that a national mandate is to blame here, or the lack thereof.
Thank you, Emily. Would
I think
anyone else like to chime in on that?
I think the schism in the administration between political and the health and science community has made a lot of people confused about what to do. There's no unified voice from the federal government based on science and based upon knowledge about what to do.
Correct. Correct. And, I think we have to really address the fact that the couple things we've been asked to do, and science telling us that does work, is the face masks, the social distancing. If we look at like the large groups, we look at the different events that have happened in different states, it is certainly proven to be true because the outbreaks certainly happen after these types of events. So a national plan does seem to point in the direction that it would have mattered, and it does matter.
Hi, my name's Tom Devontier. I just have one thing to add. You had mentioned, and we all know that masks, wearing gloves, for example, that helps against not getting coronavirus. But at the end of September, there was a research article that came out from ResearchGate, and it came from 2 studies that were done in the cities of, oh darn, I can't remember, but it was in Texas, and the SARS-2 strains that are in COVID, they had mutated to be able to bypass hand washing, and it can travel through masks. Now, I'm not sure if you've heard anything about that because I haven't heard a lot of it in the news. But based upon what I've told you, what do you think some effects of that would do, like to people in our area that have tried to get back to work and are practicing social distancing, wearing a mask? How do you think this will affect our future or even at school?
Thank you, Thomas. I think one of the things we have to consider is the fact there's 6 different strands with COVID. And when you listen to from the World Health Organization down, they haven't been able to really determine what the effects and actually what can really accommodate each one of those strands in a way where it would really make a difference. So the 2 strands have been the only ones. I did see that article with SARS, but in terms of right now, it's also been shown, and studies have proven that in areas, especially with large events, large come and goes like we have at the university, that it's definitely slowed the virus down, wearing masks and the social distancing. That has been proven.
Great, thank you.
Thank you. I think that I'm going to now turn this over to Brittany for the second topic this evening. Thank you for your participation.
Okay, thank you, Patty. So we're going to talk about the United States economy, which is a big topic. So we will have, I'm sure, a lot to discuss after this overview. To begin, I think it's important to know what the economy is. It's the wealth and resources of a country or region, especially in terms of the production and consumption of goods. So basically, it is what our entities in our country produce and consume. The United States economy overall is more of a mixed economy model, where it does have market economy principles. So those who produce goods get to determine what they produce and what they charge. Those who consume get to determine what they consume and what they're willing to pay. However, the United States government does come in with some regulations, such as safety for employees, environmental regulations. So the United States does intervene in the market in some ways, which makes it a mixed economy. We've all heard of GDP, but what exactly is it? It's called the gross domestic product, and that's the total market value of the goods and services produced by a country's economy during a specified period of time. So this includes all of the final goods and services that are produced, again, within our country. And GDP is really the main measure of output and economic activity throughout the world. As you can see in this chart, for our second quarter of this year, our GDP has decreased pretty significantly. It's decreased 32.8%. Of course, COVID is a big piece of that. Things are being produced and consumed very differently because of the pandemic. However, there's other factors that could be involved, such as foreign policy, trade agreements, and things like that as well, that contribute to the decrease in our current GDP. So our current level is at 19.52 trillion in a second quarter. National debt is another factor that should be considered when talking about our economy. The debt is the financial obligations of a national government resulting from deficit spending. Our current national debt is over $27 trillion. And this is broken down between two pieces: intragovernmental, which is basically the debt that the government owes its own agencies. So trust funds, and, oh, I apologize. Trust funds, revolving funds, special funds, basically what the government owes its own agencies. The public debt is what the government owes outside of its own agencies. So to state and local governments, to foreign governments, to corporations and other things outside of itself. So the Congressional Budget Office projects that if current laws remain unchanged, our public debt will increase to 31.4 trillion by 2030. And this level of increase could significantly impact our economy and the federal budget pretty significantly. So this projection is a little scary if laws remain generally unchanged for our future of our economy. Unemployment is another big factor of the economy. So our unemployment rate is currently 7.9%. As you can see on this chart, it really spiked when COVID hit. It hit over 15%. However, it has been decreasing as regulations have been lifted and states are allowing people to return to the workforce more often. However, when you see the breakdown, the Black and African American population is still most affected by unemployment. And this is something that remains the same pre and post COVID. It's something that has been pretty steady in our country, that Black and African American populations tend to have higher unemployment rates, as do Hispanic and Latino, and in this case also Asian at this time. For the positions, I'm not going to read all of the bullet points because there's a lot. We get our information straight off of the candidate websites. So President Trump really is focusing on American jobs, keeping jobs in America, made in America products, really creation as well, creating new businesses, creating new jobs. Vice President Joe Biden really focuses on the middle class. And if you see his website, he really focuses on building. So building the current infrastructure to really create clean energy, building off of our caregiving and education workforce, so the burden of care for working parents is lifted. So he really focuses on building what currently exists and also focusing on holding corporations more responsible. So the two both focus on small business, both want jobs, but they have different ways that they think it would work to build the economy. So for points to consider, some questions would be, do you think the economy should rely more heavily on the upper class or middle class or other? Do you think that the China trade agreement that's in place was successful for the US economy? Do you believe that there should be a heavy emphasis on rebuilding the American infrastructure that may result in good paying jobs? Do you think that what do you think is most important to a healthy economy? And do you think that public health should drive the economy, or should the economy drive public health through COVID-19? So kind of in relation to that chart that Patty had during her presentation, what comes first, health or economy, or can they really work together? So these are just some points to consider as we move into the open discussion on the United States economy. So any thoughts or up front?
Hi, Brittany. It's Tom again.
Hi.
I was thinking that the health of the like American people would come first, and that would lead into having like a strong economy. In what ways would you say, or like an example, that a healthy economy would lead to healthy people? Because I'm just not following that type of logic, if that makes sense.
Right. And you know, that question could have been worded a little iffy. I guess it's more of thinking of the future of America as opposed to the health of the population. So, and I, by the way, completely agree with you. The health of the people is very important. Whatever measure we can use to make sure that we don't lose lives through this is essential. But I guess it's the difference between the thought of, do we focus on making sure people are healthy and shut down our economy and possibly fall into, you know, more there's no production, no consumption, to make sure lives are saved? Or do we keep our economy going and with the potential of there being some health things overlooked? But that doesn't necessarily mean it has to be either or. Again, as Patty's chart showed, there were countries who were doing both just fine. So I guess it's just the question of, do you think one is better than the other? Or again, do you think we could really accomplish both?
Well, like when in the beginning of coronavirus, a lot of states decided to stay open, and like past speaker, which she had said that a lot of states still haven't closed since the beginning of all of this, and their numbers are really high compared to like New York's, where we closed down early, shut down everything, made sure we had a plan, and now numbers were quite low, but since everyone's been going back to school and businesses have been opening up, numbers are rising.
Right.
Thomas, it's really played itself out. If you look at the 36 states that the COVID is having peaking again, they have between 15% to 40% of their population that's experiencing COVID. So if you turn that into the economy and you look at that as a workforce, you might as well say in some states 25%, 40%, 30% of your workforce is idled. So when we ask why is it important to have the health first, I think those figures speak for themselves. You can't have a healthy economy, and you can't have it where people are afraid to go to work. You can't have it where they don't have childcare, they don't have somebody to worry about their kids. That all affects productivity. And when you affect productivity, it's an outright effect of the economy. So all of these things have kind of played themselves out. And for us to think that everything is good, we're okay. The scientists are still telling us that we haven't gotten rid of the first wave, and here we are looking at a second wave. All of these things need to be considered. So when we're making these economic decisions, today that was just mentioned, about 1 out of 5 small businesses have closed. Again, you've got to stop and think about, how is that going to affect reopenings? How is it going to affect new businesses? Again, if you don't have health and you don't have the people that are confident to go to work, then your economy is going to suffer.
That was well said. I completely agree with everything you just said.
Thank you.
I don't think it can be an either-or proposition. As you said, Patty, the issue is we need to have both. We're not going to have a healthy economy if a good percentage of the people in the workforce are sick. Also, when you think about the cost of caring for people who have COVID virus, that is going to be a tremendous drain on the resources available in this country. We need to have a focused national approach that says we need to develop a scientifically authentic means of either managing the disease or immunizing against it. And at the same time, industry and business need to work on ways to make their working environments safer, which they are doing. I'm not saying they're not doing it, but we need to incentivize all these different kind of businesses and industry and retail and whatever to try and make their environment safer. Also, the infrastructure of this country is a problem. You know, look at, well, let's have so many ventilations per hour. A lot of even medium-sized business can't afford right now to make the kind of environmental changes they need to make in order to be a viable business.
Right, right. And then from a health factor, in some instances, we can't afford not to. So you're absolutely right, Warren. You know, that's why the support of the federal government is just so critical in this whole effort. It really is.
I think we need to incentivize through resources from the government, businesses to have the capacity, the cash capacity to make whatever adjustments are needed. Small hotels, small restaurants, I don't see how they can afford, no matter how good their intentions, to comply with necessary health guidelines. So there's got to be a way to incentivize necessary changes.
Right, right.
Maybe a few less bombs, maybe a few less nuclear bombs might solve it. Work on healthcare rather than killing people.
Well, I don't think nationally, we can't have our president out there acting like that it's okay, encouraging everybody to go on like none of this exists. It does exist, and it's affecting everyone's life. Doesn't matter who you are in one way or another. And you know, today over a third of our children that go to schools are raised by grandchildren or grandparents. You know, that's a factor. They're a vulnerable population. You have to look at all of this. And I think when we get into our next topic of healthcare, we're going to point to some of these things. Brittany?
All right. So thank you all for that discussion. That was really insightful and good. So we're going into healthcare now. Let me just fix this. Okay, so just really quickly for terms, healthcare is the organized provision of medical care to individuals or a community. So what's available in terms of healthcare, hospitals, special practices, things like that. Health insurance is an insurance that covers the whole or part of the risk of a person incurring medical expenses. And then in the slides coming up, there are the thresholds of poor and near poor. Poor have a family income below the poverty threshold, which is determined by the federal poverty level. And this varies from year to year and is on a kind of sliding scale based on family size, but the poor threshold falls below the poverty level. And then near poor means they haven't fallen below the poverty level, but they are at or near the poverty threshold. So first, for private health insurance, which is health insurance that is offered by any private entity that's outside of the state or federal government, 61.3% of Americans report that they're on private health insurance. And if you look at this chart, you can see that typically those who fall within that not poor threshold are the ones who receive private health insurance. Oftentimes this could be through employers. You may be paying out of pocket for this level of insurance. So a majority of Americans report that they're on private health insurance. For public health insurance, this is a program run by U.S. federal, state, or local governments in which people have some or all of their healthcare costs paid for by the government. The two main types of public health insurance are Medicare and Medicaid, which we'll talk a little bit more about on the next slide. And as you can see, we have 37.5% of Americans reporting being on some form of public health insurance. And again, the poor and near poor thresholds are the ones that tend to fall onto this insurance. However, that does make sense because Medicaid is geared more towards a lower income threshold. So oftentimes people who fall in that poor and near poor group fall within the income guidelines. Medicare is the health insurance through the government that covers people over the age of 65 or younger people who meet specific eligibility criteria. 61 million Americans are covered by Medicare, and Medicaid is public health insurance that provides health care to lower income families or individuals, and about 68 million Americans are covered through Medicaid. Uninsured means that people are not at all covered by insurance. 9.7% of Americans are uninsured. This is about 30 million Americans, over 30 million Americans who have no insurance at all for health concerns. Oftentimes these people may not even go to doctor's visits because they can't afford them. And they certainly fall into debt if they have to deal with bigger health concerns or surgeries or things that are very expensive in the medical world. And again, the poor and near poor brackets are the ones who typically report being uninsured. And although people receive insurance, oftentimes the insurance doesn't cover all of the needs of Americans. So the percentage of people, according to the CDC, who report having problems paying medical bills are 14.2%, and this was data from 2018. Females, children, and non-Hispanic Black persons typically are ones who report more issues paying medical bills. Other surveys, though, as you do more research, you can see that this number really does fluctuate. According to the Commonwealth website, about 45% of US adults reported they're inadequately insured. And a 2019 study found that 137 million Americans are experiencing some form of medical financial hardship. So if you look for numbers, it really does vary, but a good amount of Americans who may receive insurance may not receive the amount of insurance they need for their medical expenses. In terms of healthcare positions, it's important to talk a little bit about the Affordable Care Act because this is really kind of a central piece for both candidates. The Affordable Care Act was signed into law in March of 2010. Its three goals was really to make health insurance more affordable to more people. It expanded the Medicaid program, and it supported medical care delivery methods that are more innovative and lowered healthcare costs in general. We have about 20 million Americans who have obtained health insurance because of the Affordable Care Act. So again, not reading through all of the bullets here, but really President Trump's website really focuses on the elderly, Medicare, veterans, and Social Security. His administration is very strong that he does not support the Affordable Care Act, and on November 10th, hearings are scheduled to begin with the Supreme Court for reversal of the Care Act, where Joe Biden really emphasizes that he would like to protect and build on the Affordable Care Act with the belief that keeping this in place and building on it will give Americans more access to affordable health insurance. So again, the Trump administration is typically looking to reverse the Affordable Care Act, and Joe Biden's campaign and administration would build on it. So for points to consider, first is, what are your thoughts on the infrastructure of the US healthcare system? And just a quick data point to reflect on is that 63% of US adults say that the government has the responsibility to provide healthcare coverage for all. Some Americans believe that they should just have one form of universal healthcare that is paid for entirely by the government. Some believe that they should provide more government options for healthcare. Also, do you believe the Affordable Care Act should be abolished? Again, a very key point for our candidates moving forward with healthcare. And do you think socioeconomic status makes an impact on health insurance? Again, reflecting on what we just discussed in terms of private, public, and uninsured individuals. So if anybody would like to begin the conversation or the discussion for this.
This is Emily again.
Hi, Emily.
point for the first question, thoughts on the infrastructure of the US healthcare system. I think that this presentation kind of showed just how many different options there are for healthcare, and it can get quite confusing. I know I have a niece who is on Medicaid, but her mom's on private insurance, and just talking to people on the phone, it's very difficult to try to figure out what they need. And for people who aren't making a lot of income, just having to pay for medications out of pocket, even when you do have health insurance, is very frustrating. I know I've had medications $500, $2,000, and it's like, who can afford this? And also just knowing that certain employees try to work less hours because they still want Medicaid, and if they work, let's say, over 30 hours, their employer will have to pay them the threshold. I'm not sure what it is for Medicaid, but if you make too much money, then you won't qualify for it. But certain employers don't have to provide health insurance to their employees. So then it kind of goes back to the unemployment rate being not the best measure, because we really need to think about underemployment. And I mean, if I'm being honest, it is the government's job to provide healthcare. It's pretty obvious in every other country in the world. And there are so many people who should not be dying and shouldn't be starting GoFundMes just to survive. But I do also agree with one of President Trump's points, is that he wanted to lower prescription drug prices. I know that when drugs are first created, I don't know if it's a copyright or something, they have like 2 years where only one company can produce them. And so they can charge $2,000 for their drug, and it's quite ridiculous.
Those are all excellent points. It's so funny that you mentioned just like the navigation of the healthcare system, because it's something that's seen, especially in lower income populations, for just health services, but also human services in general. The time that it takes to navigate the system and find the care that you need is time consuming, and oftentimes people might not have the tools to be able to find the care or the information they need to know that they're not paying out of pocket for something that they potentially don't have to. So I think that, something along the lines of a more universal system that, people are covered under could help with that navigation of healthcare. And I think also your point on employers is really important as well, because one of the critiques of the Affordable Care Act is that employers kind of changed hours and changed some things so maybe they didn't have to cover their employees under that act. So, it's kind of sad that you have to think about that, but you're right. I mean, employers taking advantage or, changing things so they don't have to cover people the way that they should. It is a huge problem, and something that no one should have to experience. So I think your points were excellent. Thank you for sharing. Anybody else have any thoughts or comments on the healthcare?
A couple quick points. One is to Emily's point, where the government, anytime there is a subsidy, the government does have the right to cut some of those prices. So those prescriptions, by virtue of the government, can be cut. The other thing is, I think that when we put the economy with healthcare, there's some things we have to think about with pre-existing conditions. How does that really affect the economy? In more ways than we even talk about. You've got somebody who's got a pre-existing condition that is now getting that paid for through the Affordable Care Act. All of a sudden that gets cut. Now you start to have this person who maybe it's dependent on them being able to work. Now they can't work. Now you have them very dependent on, if they can't work, now they have to turn to a public assistance. Now, so it's a domino effect. And I think that as a nation, to your point, Emily, we don't talk about or do enough about that. Other nations, if you look at it, their healthcare and their economy is very aligned. And because it is, they don't go through what we do in terms of people that are suffering that don't have to. They treat them like they're their responsibility, and those people go on to lead a very successful quality of life. And I think that if we just look to our other countries and some of our allies of what they're doing and what their plans are, we could be much better off.
Agree with you on that. I absolutely agree. The issue of healthcare is a national issue again. I'm not going to argue for private versus public or one payer or multi-payer as much as I am that there ought to be equitable, accessible, affordable health for all people. How it goes about being done is the issue. Well, the idea of I'm going to reduce pharmaceuticals, like how? These are global corporations. They're worth, hundreds of billions of dollars, some of them. AstraZeneca might be able to help you, or it may not. But the point is that unless pharmaceuticals are both restrained from being able to monopolize, as well as encouraged to produce basic medicines everyone needs. Look at insulin. I mean, it went scandalously high overnight. And by the way, it still has, anybody's taking insulin knows it really hasn't come down. It's come down. It's still way more expensive than it should be. Even generics is playing the game. For instance, they'll get together as a monopoly kind of and say, okay, you're going to make X medicine, we won't. And so there's not as much competition, even with generics, as they used to be, because they're agreeing among themselves not going to compete with each other.
Well, and also having a national healthcare system, you're driving those costs down.
Yep.
I read an article about when you look at what Canada's paying for insulin versus what we pay here, it's like 2/3 difference.
Mm-hmm. And it's all pure profit at this point. There's very little R&D in insulin right now. Mm-hmm. It's all just a matter of producing a quality and medicine at a profit, but it doesn't have to be an obscene profit. And that's what insulin and some other drugs have become obscenely profitable to the people who own the companies, but to people who are, let's say, lesser than poor or near poor, it's become a disaster.
Mm-hmm.
I just want, I'm sorry, Warren.
No, it's okay.
As we all come together and we look at all the other countries that have these like premier health for like the people, because they're supplying like their services for the health. I'm sorry, I don't know why I said that. Okay. But my point is that when it comes down to the American society, we live in a capitalistic nation where we're all just trying to make money this way, money that way. And these people, they have hundreds of billions of dollars, like you said, Warren, which I agree with you. And they've been doing this for such a short amount of time because we've only been a country for a few hundred years. So for us to make that dramatic shift with this presidency, like democracy is on the line, people say, I think it's a lot more than that. It's if, for example, Joe Biden does get elected, then there are going to have to be some major steps put in place for us to be able to go down that channel per se, but it's going to take a lot of time because like in many other countries compared to ours is like built on selling. That's my opinion.
Yeah. But healthcare is kind of almost like a utility in a way. It's something that is basic to a quality of life. And maybe we should think about that even though private enterprise is our system, as we said before, there's some regulation within private enterprise that allows for utilities and other basic needs to have leverage in terms of what's available to people. I think it's going to take a large corporate shift in culture.
Well, I mean, if there's 3 people, I can go.
Oh, okay.
Yeah.
It's not going to be a short-term solution. It's going to have to take a national will to restructure, rethink for the good of society, as well as the bottom line of private companies. Sometimes they compete with each other, which is more important.
Mhm.
Absolutely.
You're going to reach out with other issues too, like quality of air. Maybe that you have to buy oxygen like they do in Japan in the big cities. Should being able to breathe clean air be a right, or is it just a luxury? And healthcare is in that arena. Is healthcare an absolute right, or is it an absolute privilege that people have to pay for to get?
Right. No, that's an excellent point, and thank you all so much for talking. Again, some excellent points made there. Next week we'll talk about climate change as well, so we'll talk a little bit about air quality at the next webinar. And just for the sake of time, to move on to another very important topic and to pass it over to Kara on racial equity.
Hey, thank you, Brittany, and thank you everyone for your thoughtful responses. It's been really, really great conversation. So I'm going to get into a quick definition of what racial equity is. And so I have a definition here from the Racial Equity Tools website. So racial equity is the condition that would be achieved if one's racial identity no longer predicted in a statistical sense how one fares. When we use the term, we are thinking about racial equity as one part of racial justice. And thus we also include work to address the root causes of inequities, not just their manifestation. This includes the elimination of policies, practices, attitudes, and cultural messages that reinforce differential outcomes by race or fail to eliminate them. Okay, so the way that this is broken down is into some of the very things that we actually discuss on this call. So when we talk about racial equity, we're going to look at 5 different components: education, wealth, housing, unemployment, and health. So first, so 2/3 of, when we look at education, 2/3 of minority or minoritized students will attend schools that are predominantly minority. Most of them located in central cities and funded well below those neighboring suburban cities. In predominantly minoritized schools, which most students of color attend, schools on large or average more than twice as large as predominantly white schools and reaching 3,000 students or more in most cities. On average, class sizes are 15% larger overall and 80% larger for non-specialized education courses. So when we look at wealth disparities, in 2016, the average wealth of households with a head identifying as Black was $140,000, while the corresponding level for a white head of household was $901,000, nearly 6.5 times higher. And what's critically important to mention in this is that it's not just looking at wealth as generating income, for example, from like your respect, like where you're working. This is like also what they call generational wealth, so passed on income. So there's how homes, if you're passing down any like real estate, for like, so real estate, for example, if you're passing down assets, right? You know, maybe some gold or jewelry, you know, jewelry that appreciates over time, or even like assets, stocks and bonds. Housing. In the first quarter of 2020, the Census Bureau reported that Black households had the lowest home ownership rate at 44%, nearly 30% points lower than their white counterparts. The Urban Institute cites multiple prior studies show that if home ownership were racially equalized, the racial wealth gap would diminish. Even if Black mortgage applicants had credit scores and debt ratios similar to those of white borrowers, they would still receive unfavorable mortgage terms. And so I have a chart here that we will talk about on the next slide, looking at unemployment. But if we look at unemployment rates by race, Hispanic or Latino ethnicity in 2018 average, it's important to note here that Latino and Hispanic are not synonymous terms. They are different. When we reference Hispanic, Hispanic is referencing those individuals who identify, you can trace their lineage to Eurocentric, back to Euro. So it's more Eurocentric based. For example, Spain, right? We're talking there. If we're talking about Latino or Latinx, we are referencing those identities who intersect more in the areas of Hispaniola. So we're talking about the Dominican Republic, Puerto Rico, and surrounding neighborhoods, Cuba, for example. So if we look here, exponentially, there's a shift, right? So we look at white unemployment rates, but they're higher when we look at other minoritized communities, specifically Black and brown. Those who identify as Native Pacific Islander also has some pretty staggering rates there. So we can go to the next slide. Thank you, Brittany. So unemployment. According to the U.S. Bureau of Labor and Statistics, in the third quarter of 2020, which is where we're at right about now, 24.4% of Black Americans between the ages of 20 and 24 were the highest unemployed minoritized groups. Now, it's important to note here that part of that is because of the coronavirus pandemic. Unemployment rates are high in general, but we really do see this more often than not with individuals who come from minoritized communities, specifically BIPOC or Black and Indigenous people of color. And then in health. Health is one of the big points of racial equity, and I'm glad that we just ended with health and understanding like the infrastructure of health. So a Black woman, and this is a chart from ProPublica that was published in 2017, but a Black woman is 22% more likely to die from heart disease than a white woman, 71% more likely to perish from cervical cancer, and 243% more likely to die from pregnancy and or childbirth related causes. So if we look back to the coronavirus, there was actually a study that was released today that stated that Black and brown children, teenagers in this age cohort who are dying from the coronavirus, particularly are Black and brown. And one of the reasons that, really the reasons that they're saying this is happening is because a lot of the family and the family structure, a lot of the people who are working in the household are individuals who are first responders or what they call essential workers, working in supermarkets and whatnot, or lower paying jobs and coming back with the virus. And then in turn, it's being spread to their families and whatnot. And then the sociological factors there, environmental factors play a very big pivotal role in these numbers and these staggering statistics. Also, when we're talking about racial equity, it's important to know how bias plays a role in this, right? The thought process that individuals, especially individuals who identify as Black or African American, don't feel pain or don't feel when they come in sick, their requests are not seen as the same. It's different, right? So this is where a lot of these numbers are coming from, and we can see this mapped out in history and in a historical context. So what are the racial equity positions of the candidates? So on Trump's website, and we did a lot of research trying to identify what was his stance on racial equity. So information gathered for this presentation was collected from the presidential campaign website, but President Trump did not list his stance on racial equity respectively. But Biden, if you go on the Biden website and you look at his position, if you type in racial equity, this is exactly what is listed, what he is going to do, what are some of his initiatives. So I'm not going to go through all of them in the interest of time because I want to give opportunity for you all to share your thoughts and feelings and some of the guiding questions. But some of the ones that really stand out is promoting diversity and accountability in leadership, key positions in all federal agencies, building a 21st century care infrastructure, reform opportunity zones to fulfill their promise, make historic commitment to equalizing federal procurement, ensure his housing plan makes bold investments in home ownership, right? And access to affordable housing for Black, brown, and Native families. Going back to that wealth gap, right? And how do we how do we bridge and how do we close the wealth gap? So opening up opportunities. So a lot of really ambitious goals that are listed and initiatives that he is listing on his campaign and with his campaign. Okay, so we're going to get now into the points to consider, and this is the last one for the night. Can a divisive leader unite during divisive times? Do you think we have a workforce development or do we have workforce development opportunities that provide for a diverse workforce? How important is racial equity to our nation? The United States is known to be a melting pot of different backgrounds. Do you think we appreciate those differences? And last, do you feel that we have progressed as a nation in terms of understanding and identifying racial and cultural differences? So now at this time, we want to open it up to your responses to these questions. thoughts?
Hi, it's Tom.
Hi, Tom.
Hi. Your last point there, the last question, that have we progressed? I feel, my own opinion, that certain demographics of where people are localized in this country, we have grown together, whereas I would say in other states or other demographic areas, people have grown apart. And even when Floyd died, it was like a few months ago, we saw everyone going out into the streets, even during the pandemic that's going on, to spread that awareness and say that we are sick and we're tired of this happening. So that is an example that we do identify the racial and cultural differences, but I feel like there can be more and there should be more done to spread that awareness to less educated people who are deciding to just believe what one person has to say, and that's a fact. Cough, cough, Donald Trump. Thank you.
Oh, well, first off, Thomas, thank you for your thoughts. Really insightful there. And I want to hone in on a point that you made at the very end. I think what's critically important to understand about racial equity and bridging these gaps is that it's going to take all people to do so. And so this is racial equity work is not just for a specific demographic of people, right? Racial equity work takes all hands on deck. So I do agree. I think in certain areas, like you said, we can see this from like a per capita view, like, right? There are going to be some more states that are maybe a little bit more, I'm going to use the word liberal thinking, right? In terms of how they identify and address racial and cultural differences. But when we look at the nation as a whole, right, it really does lend to the question, where are we at right now? Have we moved forward? Have we progressed? But I do like that you said, you brought up a really good point, that we always have a ways to go, right? It just doesn't stop in one area. You always are developing, you always are growing. Language changes, a society changes. So do we stay stagnant or do we change with it? So thank you, Thomas, for your response.
I think there's been some improvements in terms of moving towards racial equity and cultural ethnic equity, but we have a long way to go. I think the elections that we're going to have in a few weeks are going to be a bellwether of whether or not we're going to continue to move in a good direction or whether or not we're going to further regress. I think the current president's thinking is pre-1950. Up to that point in time, the issue of racial equity wasn't a concern at all. It was by people who were advocating for it, but for the general public, watch any TV programs from prior to 1950, and you'll see bias was all over the place. Bias and discrimination were an accepted way of life. I'm sure some people are alive from today who lived before segregation was declared illegal. I'm sure there's a lot of folks out there, I hate to say a lot, but there are some folks out there who'd be glad to see that reversed and reimpose segregation again. The question is, who is controlling society and who is setting the cultural agenda for the future? A lot more people don't smoke than in the past. Smoking was very acceptable in the past. Racial prejudice, racial bias, ethnic bias was just accepted as a norm. But how we go, I think a lot depends on the next 4 years. It's not going to, the next 4 years, Biden can't solve the problem alone. It's going to be up to all of us to take a stand and affirm it. And I did a program on racial inclusion and equity in healthcare delivery a few weeks ago. And there's two kinds. One is like implicit, meaning that you don't even know you're doing it. And I think it's like COVID virus. A lot of us have it, even though we don't know we have it. And that's, I think, the problem with implicit biases. We got the virus, and we don't even know it, and we don't want to think about knowing it because that might involve making real changes, and a lot of people are uncomfortable with making changes, and change has to be the byword if there's ever going to be equity in our society, or greater equity.
Wow, Warren, what a way to close this out, right? That was a really great point, and I'm glad that you brought up implicit bias. And when you started talking and you were making your points, that was the first thing that came up, right? Implicit bias, we all have them, right? We all have biases, but it gets into that next level step. We could look at this from stereotyping to prejudice to discrimination when we're talking about racial equity. Stereotyping is the feeling, prejudice is the thought, and the discrimination is the action, right? But biases all encompass all of these things, right? Because it's how we form and how we navigate, how we, how do we do certain things? How does culture shape into this? How does our experience influence our biases? And there's so many different types of biases. And we see it play out now with affinity bias, right? If I am on Facebook, for example, you can see a good example of this with social media, and we're talking about the election time. If you sway, if you like certain posts, if you sway to certain things, you're going to start to see things on your feed that will agree with what your vantage point is. That's like shift into your culture. Sometimes it's done on a conscious level, sometimes on a subconscious level. So how do we navigate those biases when we're interacting with those who may not share the same identity as us? And I do agree with you, Warren, to your point. We do have a long way to go. And this work is going to take all hands on deck and acknowledging our biases. So thank you for bringing that up. It was a really great point. Great.
And with that, I'm going to, for the sake of time, I'm going to have to cut us off. But I think in closing, there's a really good point to make here. And I thank you, Warren and Kara, for bringing us to this point in time. Because it's a little alarming when you think that if you look at your positions, Kara, that you couldn't find the words racial equity on our current president's website. And without any sounds of sounding political, we're in 2020. I go back to the 60s and think about John F. Kennedy, Lyndon Baines Johnson as presidents. Racial equity was at the top of their agendas. We are in 2020. And whether it's racial equity, or we're talking about wearing a face mask, or we're talking about social distancing, this is what our country has always come to expect from our leaders. And we have to ask ourselves at this point in time, do we still have those expectations, or is this what's going to change in our country's future? Because that's what's going to really be the deciding factor. So with that, I really want to close tonight and thank all of our participants for a really great conversations, and we hope you join us for these next few weeks, our Wednesdays and Thursdays. They're on our website. We have all of our resources. We hope you'll continue with us. I want to thank Brittany and Kara for two excellent presentations who really gave us food for thought. And if anything else, please remember, as our closing point for tonight, the whole intent of the series, what we're doing here, is not to be political, to give you a critical lens from factual, good information, and form your own decision, and really realize that your voice and your vote matters. So with that, I'm going to close tonight and thank all of you for participating. We hope to see you next week. Have a good night. Have a good night.
Please take a moment to complete the post survey as well before you sign off. Thank you so much, everyone.
Thank you. Thank you. Thank you, Brittany, and thank you, Patty.